a group of South African doctors has launched an urgent court application. They are seeking easier access to ivermectin. SAHPRA, the regulator, intends to oppose the application set down for the 22nd of February in the High Court in Pretoria. Well, let's discuss this matter now. I'm joined by one of those doctors, Dr. Naseeba Kathrada, who can tell us a little bit more. She's from the I Can Make a Difference organization. Dr. Kathrada, good morning, and thank you very much for your time. Can we just start first by getting clarity on where is the legal process at currently from what you know? We've got the 22nd of February looming. What's the latest in that process?
Well, I've had to learn a lot about legal things now, being a medical doctor, so we know how this process works. So we've sent in our founding affidavit, which means that we've made the court application, and the people we've made the application to are the President of South Africa, because he's in charge of the National Command Council. We've made it to Dr. Simeti herself as the chairperson of SAHPRA. We made the application to SAHPRA as an organization, and also to the Health Minister, Dr. Zweli Mkhize. So when we did our founding affidavit and we submitted on Monday, we got a response just from SAHPRA saying that they are opposing the affidavit, which means that they will argue the case in court. The other three the other three applicants we went up against said that they will go with whatever the court rules. So we've just been opposed by SAHPRA. So they've got until Monday, the 15th of February, 1 o'clock, to send us a response affidavit, and then we will send something back, and then arguments will take place on the 22nd of February. And as I understand it, there was a ruling made prior to our application that all ivermectin cases will be heard on the same day. And so there's three other groups that are going in with us. We are a group of doctors and healthcare workers, as you said, called I Can Make a Difference. And we are seeking relief for the use of ivermectin on a per script basis, as opposed to filling in a Section 21 application, because it takes so long.
Okay,
what we are asking for help.
Yeah, sorry, carry on. Also, you're asking for government?
Give healthcare workers the right to take it as prophylaxis. So they must be allowed to have prophylaxis, and we're asking for the application process to be an easy one, because we're dealing with lives here. It takes an hour to fill in an application form, and when the name changed from Section 21 to Controlled Compassionate Access Program, nothing changed. It still takes 1 hour to fill in a form. I filled in 5 applications. To date, I haven't received a confirmation on 3, and I've got pending on the first 2, which I did 4 weeks ago. So the turnaround time of 24 to 48 hours doesn't really exist. Okay,
you've touched on a number of things. I was asking first about the legal process. Thanks for clarifying. You're expecting a response affidavit, so to speak, from the regulator SAHPRA on Monday the 15th, and all matters related to ivermectin will all be lumped together and head in court on the 22nd of February. That's good. But now, coming back to ivermectin itself, you were just beginning to clarify what you want. What are you exactly applying for? Are you applying for it to be part of the COVID-19 protocols?
Not at all. We understand that SAHPRA's main contention with this drug is that there isn't enough evidence for it to be used on the protocol, and we understand that. In fact, we clarified that in our affidavit. We are not anti-vax, we are not against the vaccines, and we are not asking for ivermectin to be put onto the COVID-19 protocol. However, because of the issue with the registration lapsing, etc., and SAHPRA banned the drug on the 22nd of December, it is now illegal for a doctor to have possession of tablets to give to their patient without a Section 21 application. And we have done due process. We went through the process like SAHPRA asked us to, and we're saying that this is it's a cumbersome procedure, and it takes really long, and a doctor cannot be filling in a form that takes an hour per patient when you are seeing 40 to 60 patients a day. So we are not asking...
Has ivermectin been administered before to humans?
Yes, definitely. I mean, we were using it in South Africa. It's a Schedule 3 drug here. It's also on the WHO list of essential medicines.
What is it used to treat? What is it used to treat? What is it used for?
Well, currently it's used for scabies, lice, and parasites, and it's used for river blindness in Africa. And also Merck, the company that was making it originally, which is now MSD, they gave away 4 billion free doses for river blindness in Africa, and they've done a free program through the WHO since 1987. But there are now 5 countries that are that have got ivermectin on their protocol. So India, Argentina, Belize, Macedonia, and Slovakia are now using ivermectin as part of their COVID-19 protocol. In fact, Zimbabwe is using it as well. They do it similar to how in South Africa.
So just very briefly, we're just running out of time now. Ivermectin is used for those diseases, and its benefit in the world of COVID-19, what does it do?
Well, it's an antiviral and it's anti-inflammatory. So it can be used for prophylaxis, early treatment, mild treatment, and for moderate to severe treatment. It can be used across the board.
So how confident are you that you'll win your case in court come the 22nd of February? You plus the other organizations that are now taking government to, the regulating government to court over ivermectin.
Well, Dr. Andrew Hill's meta-analysis is due to be out on the 15th of February. We are eagerly looking at that because that will prove to SAHPRA how effective the drug is. In the meantime, we're saying let us try and save lives, because what is the worst that can happen? We're going to lose a little bit of money. So we're saying let's try and save lives.
Okay, thank you very much, Dr. Kathrada, for clarifying their stance on ivermectin. We'll have to wait and see how SAHPRA, the regulator, responds by Monday, which is the deadline that they've been given, Monday the 15th of February.